Hey, everybody, welcome to another edition of Total Health Live. This is episode number 46, ironically, because we now have the 46th president of the United
We
States.
do.
I'm Dr. Chrisotpher Vogelmann of drvogelmann.com. You can find me anywhere on social media as Dr. Vogelmann. Pretty straightforward. And with me, as always, is our lovely, talented nutritionist to the stars, as I call her.
Me, Monika. It's me.
Monika. You, Christopher. We talk good.
I'm going to pound my chest, right? Or is that just the male? So with that, let's begin 46.
46. We're going to get some tricks from 46.
So,
hey, yeah. What do you do, by the way? You are a nutrition. I call you the nutritionist of the stars only because you were in all these wonderful areas, like, where people hang out, like the Boo and other places.
Yeah, Malibu. I mean, I'm in the Southern California, Los Angeles area. So
she's my SoCal pal.
SoCal pal. But so yes, I've mingled.
You've mingled when you were single and when you were married.
Yeah, you just mingle when you can. And but now it's a Zoom mingle, which is
Zoomy.
A funny way to live.
Yeah, it's virtual, but I think the important thing is that with technology, we have a chance to connect with people from all over the world. And as long as you have a sense that someday this too shall pass, it makes things a little bit easier.
This is our only hope, I believe. So it's interesting about the COVID news because my husband just had two telehealth.
It's a hell of a health problem.
Hell of a health problem, yeah. And but we were talking about vaccines with both physicians, and so it looks as though dialysis units will start administering them when they have it. They don't like shortage, so we all know about that. So, but yeah, this is a very trying time. Needless to say.
But we should keep trying, even in trying times.
Even trying. So the interesting thing is, the LA County area and is sort of being equated to New York in the last spring, sort of the proportion.
It is the epicenter of the nation at this point.
But I find it interesting. I just thought about this. It's very interesting because we're having like a lot of warm weather. And this is supposed to be predominantly a problem in cold weather. So that doesn't make sense. I mean, there's so many things that don't make sense, but that doesn't make sense at all. I mean, it was 90 and high 80s all last week, if not the week before. So what say you to that, Christopher?
Well, I think it just has a lot to do with how people congregate more than the temperature. And the theory in most flus, for example, most epidemics, is that as the weather gets colder, people tend to stay indoors and have closer contact with other people.
Well,
so it's a question. I think it's more a question of proximity because you have huge outbreaks in Brazil, which is hardly a cold area. So.
And it's summer there right now.
Yeah.
But the interesting thing is they're still mentioning that as being a factor, a critical factor. And yes, if you can't go outside, you're going to congregate. Even in the summertime, you're going to congregate indoors. So.
And the whole party thing, people are stressed out. They want a little relief. They want a return to some degree of normalcy because, we're going on 10 months or so. And I think that's really the issue. I've seen a lot of people, unfortunately, through social media, whom I know who've gotten sick at parties and other things like that. And
parties, they're at parties. Okay,
some people are at parties, yeah. And we have a dearth. I would say we have a lot of people who come in on weekends here to Coronado because Coronado Island is a tourist area, and I just stay off the main drag of Orange Avenue now because more than 50%, probably 70% sometimes of people are not wearing masks. And I just don't want to be around them, especially when they're yelling and, all kinds of things that.
So walking, you don't want to wear masks when you're walking, or do you wear masks?
I wear a mask when I'm walking.
I do not.
Yeah. I mean, but the thing is because of some of these areas, as I'm walking, I don't want to keep putting mask on and mask off, mask on, mask off. So I just keep it on.
Mask off, mask on.
It's like wax on, wax off.
For me, I when I see someone coming close, like quite a distance, I will cross the street.
I do a lot of that.
If I have no other option, I'll put my mask on.
We actually go into the street sometimes because in the street here, there are bike lanes too. And so we'll just walk past a few people on the bike lane and then get back on the sidewalk.
Yeah. So I have a boulevard here. So sometimes I'll just be walking. I know it was, I think it was Christmas Day or New Year's Eve or something like that. I was walking on the boulevard and like in the morning. And I think the patrol car thought like I was wanting to do something strange. I'm like, no, I'm walking here because it's the safest place to walk.
I am not a street walker. Thank you, officer.
Yeah.
Even though I'm walking in the street.
This was my sense that they thought, anyway. So yeah, that's what I do. But I've had some issues with my foot. So I have stopped walking for the time being, and waiting to get my new sneakers. Cushioned Hokas. I'm looking at HOKA Hoka sneakers that are really very cushioned and really good for. I have this metatarsal issue, so that's what I'm getting. And I know you evaluated my.
The best I could from your pictures.
Yeah, it's hard. It's hard because I haven't got these brand new orthotics. I didn't go in to get them properly. Whatever. The mold's done, so I did it at home. So it may be not the right fit. So it's been kind of complicated, to say the least.
I'm trying to get this out here to Twitter for our friends there because I forgot to put that on there.
So yes, Chrisotpher was evaluating the orthotics, and so it's for anyone out there who's having a similar issue with trying to be fitted for orthotics, because I think a lot of people are, putting on their sneakers and getting out and walking as their only way of getting some fresh air for one, some stress relief, and some just being out in nature.
Well, and a lot of gyms are closed.
So we have to do something, and walking is great. I think I mentioned last week, I saw 3 deer on my walk.
Oh dear.
It was wonderful. They were actually not standing this time. They were sitting in the ground, just really looking at me and making sure I didn't come close. But it was wonderful.
Yeah, we've had, there's a lot of issues of the rollout of the vaccine.
Yeah, so that's the vaccine. Lots of issues.
Yeah. In fact, one of the things I wanted to do, let me share this little screen just for a second here, just because I found this kind of interesting. It was USA Today, but quoting CDC. So maybe we can just take a peek at this for just a second, and then we can get out of this. This is the second vaccine dose, allegedly, according to the CDC, can be given 6 weeks later instead of wasn't it 4 weeks before? Or 3?
Yeah, it was 4 weeks. And and in fact, there's a new vaccine that's only going to be 1 dose. And I believe...
is that AstraZeneca or what is that?
I think it is. And I was asking the neurologist about, Moderna had a stop on their vaccines because there was an issue in Central California about reactions, I think 10 people. But yeah, they stopped it. And I think they're about to resume again.
Yeah.
So there's AstraZeneca, and then there's Johnson & Johnson is coming, the 4th company to come out with.
Yeah, we've crossed over 411,000 deaths. I think at this point we're kind of averaging close to 4,000 a day right now. Yep, there's the 411 that I was looking at before. But the ambitious program of vaccinations is interesting. Now, whether you're pro-vaccine or anti-vaccine, it really doesn't matter. It's just interesting to see how the logistics of this play out in terms of dealing with a public health crisis. And the UK has a real problem now.
As I mentioned, probably our first 2 weeks back when our first of the year, it seems like how everything's being managed or not managed, it seems like it just happened rather than it almost being with us for a year.
I think there's just a lack of proactive planning going on at this point, or has been. So.
Yeah, definitely in this country. My mother had the vaccine 3 weeks ago. Yeah. And,
and she didn't have any reactions, did she?
No, she didn't. But all first line workers,
Yeah.
healthcare workers are getting it, and all people in care facilities. My brother-in-law was just tested positive. He was in the hospital for the last 4 months due to
Yeah.
a reaction to a kidney transplant. So, but he's fine. I mean, he has no symptoms, and my sister has no symptoms. So, yeah, I mean, it's everywhere. It's everywhere. And in Canada, it's not as bad as it is here.
Mm-hmm. I think we've got sort of the attitude in this country of the at least among certain population, the whole live free or die, carrying the snake embossed yellow flag, and it's also the motto of the state of New Hampshire. But my sense of it was be mask free and die, or that you're increasing the transmission without using the masks. And I think rather than a symbol of political repression, I just see it as an inconvenience. And maybe that's just a difference in perception and attitude.
I mean, I don't know. Again, there's just too many things that are very suspicious. And I mean, I don't know. I mean, I'm definitely going to be wearing a mask. I'm definitely going to be doing whatever I can, more so to protect my husband, but of course myself, but he's, very high risk. But so, I mean,
well, you also have to admit that we don't want to transmit if you've had potentially or being a carrier or something like that. So I think a lot of times people look at it as the mask is trying to protect themselves from somebody else, but it's also in case you are unknowingly running around with the virus and have the potential of being a super spreader yourself.
Well, yeah, and that's of course that's been it all along. But those who think that rights are being eroded, it's more of a it's not as bad as it appears. Mm-hmm. That's their mandate, and I don't know. I simply don't know. All I know is what I need to do, and I hope that if masks. Again, I mean, we've been talking about this ever since the start. If there's a one iota of it helping, let's just do it. Why don't we just do it?
Well, the popularity of the Masked Singer on Fox as well as the Masked Dancer. Anyway, but in popular culture, the Masked Singer is
I know
a very
about
popular
it.
show.
Yeah,
so so if people just say, "Hey, I'm pretending to be on stage as one of the Masked Singer participants," it might be easier.
A lot of people don't like that show.
Well, what I'm just saying is that you can reframe any sort of thing that you're currently experiencing. And I remember one of the most predominant signs of intelligence in organisms is adaptation, the ability to adapt. Mm-hmm. And those species and organisms that refuse to adapt are often rendered extinct, or at least they shrink in numbers. So
people on the other side might be saying they're the adapters. So,
Well, yeah, except for the fact that we have a couple nurses we know from ERs who say that the saddest thing is to see somebody who still doesn't believe that they have it pass away. Wow. Because they can't talk to their family members. They can't, and I think we've seen this a lot when somebody believes something so rigidly that it flies in the face of facts, of scientific fact, they will defend to their death the right to continue to believe this type of a thing. And maybe it gives them comfort to be in denial. But I think at some point you have to look at the facts and you have to make a decision about whether you are pro-life or you are sort of pro-unrestricted egotistical freedom. So.
And that's a loaded term, pro-life.
Hey, you're in favor of life or you're in favor of disease. I mean, it's interesting because those people who...
Well, pro-life is usually...
It's usually done in the whole anti-abortion movement.
Yeah. See, but you're not talking about that.
No, not at all. But I've always found it kind of ironic that people who were pro-life in terms of anti-abortion were also pro-death penalty. And the consistency I saw within people like the Pope Francis and others was that if you're pro-life, you're pro all life. You're not just, in the situation, situational ethics. But back to the COVID thing, we were talking about the rollout And I think it's a numbers game at this point as to how quickly these vaccinations can occur. I would say that at this point, it looks as though the new president's plans are very ambitious, and it's just a question of the logistics. How do you mobilize the distribution? And I think they've even looked at places like making it available in national pharmacies like CVS and Walgreens.
Yeah.
And
In fact, that's what two of the physicians did mention yesterday is to look at the, and I think that's good for, most people, certainly not when someone is high risk, like I'm talking high.
Well, or in rural,
used word now. So,
or in rural areas where there are no chain pharmacies.
Yeah. So. I mean, high risk is such an overused term that we don't really know what it means. But if someone is, high risk and high mortality and high morbidity, which is something that is determined often when someone is hospitalized. I mean, there are degrees, of course, and I mean, anyway. So there are phases. I think dentists have already gotten. I think they are phase 2 or something like that, whereas healthcare workers were. Or in fact, they are healthcare workers. So
they're healthcare workers, but they were looking for hospital and urgent care center workers first,
and also skilled nursing. Yeah.
So I think it's not a bad idea to exercise a degree of caution in an epidemic, or in this case, a pandemic. And I think that leads into the whole discussion of making sure that you're taking enough supplements to boost your immune system. So God forbid you do get the infection, that your response will be relatively mild compared to somebody who's not really addressing all their nutritional needs.
And there's also, there are blood type factors too.
Yeah, that's interesting. That's very interesting. I do think that's very interesting. It's who is that? Diadamo? Or who's the blood?
Well, Diadamo did the blood typing, but even regular physicians see, like an A blood type A may be more susceptible to various autoimmune conditions. I mean, that's very commonly known. But there's so many factors. I mean, there's so many factors that go into this.
I could verify that in some ways just from anecdotal evidence, because my mother was a blood type A and had some very severe autoimmune disorders towards the last, I'd say, 15 years of her life.
Yeah.
And I'm an O, and as well as most of the other family members. But what's interesting is I think you do get kind of like a blood type dominant, which was O, because I saw some characteristics in myself that were A. So it's like a big O, little a. So
well, yeah, I mean, there's a subtype. There's subtypes as well. But O, O's tend to have things like more like stomach issues, gastrointestinal issues, and arthritic problems, whereas A's tend to be more correlated to cancer and autoimmune, which cancer is, of course, an autoimmune condition as well. So, and then the B's are more rare types of illnesses, and the AB is sort of a combination of all of the three, all four, it's a combination of all of them.
And of course, is the rarest of all and most in demand sometimes for their blood.
Yes, it's, but they can accept O.
Did you see the thing with Daniel Amen? Did I mention that last week that he did a live where he talked about going to Disneyland? And he and his wife went to Disneyland and they got their vaccine, and everybody just people in this live just went nuts. It was 18 minutes, and Dr. Daniel Amen, as we talked about, is very famous for his somewhat unorthodox techniques and procedures with respect to brain health, but he does some wonderful work. And I've had a couple of friends who have actually gone to his clinic for post-traumatic or concussion disorders and brain injuries, but people were just attacking him as a sellout for getting the vaccination. And they weren't really listening to him, which was very interesting, because he said, look, I'm not saying everybody should do this. I'm telling you, this is what I did do. And he says, I'm not stopping any of the natural remedies that I am taking, but I'm exercising a greater degree of caution because of the after effects that we've seen in brain health.
Yeah, very, very interesting. And with my television show, which I had on for 12 years, Total Health Talk, I had both Daniel Amen and Peter Diadamo as guests. And so it was great to know of their work and to be able to share it with my viewers. So yeah, I mean, just because we are alternative medicine thinking, or, we're looking at more functional medicine, doesn't mean we will say no to a vaccine if it's offered.
Well, no, I mean, if I have
you have to.
If I have a broken leg, I'm not necessarily going to take an herbal supplement. I would probably, if it's depending on a bad break, just like with my father, I saw him 8 fractures of his lower leg. He needed some support in there. So he had steel rods and screws and pins and things put in there. Of course, I did tell him that he'd been screwed by an orthopedic surgeon. He didn't appreciate my sense of humor at the time.
I mean, even diagnostic
tests are great.
Yeah, I mean, those are always great to get information, and so then you can choose the type of medicine you want to use, whether it's Western or Eastern.
Well, or you have the integrative medicine.
Yeah, exactly.
Where I would take the pulses, for somebody for my traditional Chinese medicine training, but at the same time I might use ultrasound.
Yeah.
And so it doesn't mean that you
take the best of all worlds.
Yeah.
You take the best of all worlds.
Take the very best of all.
So are you going to get the vaccine, Christopher?
I am not sure. The funny thing is I've never been vaccinated in my life.
She shared that last week.
And so I mean, technically I was vaccinated because in 1967 or so, we were going to Europe and you needed the smallpox vaccine at that time to go to Europe. But we got the whole thing where they pricked your arm, but my dad immediately wiped off all of the vaccine toxin.
You don't know.
But as soon as we got into the car, he had alcohol there and he was wiping us all down to get rid of it. And the reason for that was that we had seen my grandmother, his mom, get the smallpox vaccine, and her arm blew up like a balloon. She had a giant scab that was about this large and this tall, and she had a lot of problems for quite a few weeks just trying to get over the vaccination. So I think that for me, I would exercise a bit of caution. I do like the fact that it's not either made from the live or dead virus itself, but simply the messenger RNA. And so that gives me actually a degree of comfort that probably the vaccine is generally extremely safe for people. It may be the reagents or other ingredients inside the vaccine that's giving that allergic reaction to people, or maybe people just aren't good with messenger RNA from a virus.
It's synthetic.
Yeah. It's synthetic. Yeah. And so I think with most synthetics, you can get different reactions from different people because we all have that genetic variability and we have the biochemical individuality where each person will react slightly different. One size does not fit all.
Well, this was my concern with my husband because he's so, I'm going to use something else besides high risk. He's so vulnerable. Let's use that word.
Somewhat compromised.
Not somewhat, very compromised. So, my question was, because of that, is he more susceptible to having a reaction because he reacted to a shingles antiviral that put him in a near coma? So, I mean.
Well, in that case, I would say you definitely want to exercise caution because herpes zoster is a virus. Of course, it's not a coronavirus per se.
Well,
but I mean, a virus. Some people would argue a virus is a virus, but they do differ in terms of.
What he told me was that antiviral is very different from a vaccine.
Yeah, definitely.
So
this was an antiviral for herpes zoster. It wasn't a vaccine.
But this was not for, this was for shingles. Yes, it was herpes zosters. So what are you saying? No, it wasn't a vaccine. It was an antiviral.
Oh, that's very different.
Cyclovir is what it is.
Gotcha. I thought it was.
No, and that's interesting because he's had a couple of cases since then. And so anyway, so you can get a shingles vaccine as well. That's available. Yeah. But
but I've never really had any of those things. I mean, as I told you before, my father just wiped that stuff off.
So what happens if you're around someone who has shingles? You could get chickenpox.
No, because I've already had chickenpox.
Okay. Okay. You had it because you didn't get vaccinated. That's
They
right.
get
I
vaccinated. I
started,
mean, the funny thing is, most of the kids in my grade school got chickenpox.
yeah, I got it
It
too.
wasn't a big deal back in the. You just got them, and then you got over them. So,
So what they started doing in 1995, they started vaccinating for chickenpox,
mm,
which is unfortunate because now there's this whole population of young people, up to 25, I guess, starting at 25 down, that, they're vulnerable to shingles now.
mm,
And so if you're in the health profession, you have to get these vaccine booster shots, I think every 10 or 12 years.
mm.
So it's a very complex.
It's complex and controversial, and I will say to
It
you
really
that
is.
I do understand those who want to just say, okay, just let the virus run its course. The challenge is, do you really want to see a huge number of your population killed off by something that could be prevented either through preventative measures like masks and social distancing and washing your hands and using a hand sanitizer, or are you a vaccine is another example of a preventative measure, or are you just content with sort of your natural selection, survival of the fittest, and grandma's got to go, she's got to go, and
Yeah, and that to me seems very
it's a huge ethical
yeah,
problem. So.
yeah.
And it's the same thing. At what point do we stop heroic measures in a patient who's been in a coma for 2 months or so and is on life support? These are ethical questions that actually haven't really been addressed that much. I mean, I think the saddest stories I've heard are doctors who have to triage patients now, or the EMS people, where the ambulance driver and the people on the ambulance are saying, "Oh well, we don't think this person's going to make it, so we're not even going to take them to the
So
hospital."
they're making this decision. They're doing
They're doing the triage, and
the,
I mean, you could say,
they become the ethicists.
yeah, you could say they're playing God at that point. So
But yeah, I mean,
it's one big hot mess.
it is really,
Yeah.
really very.
So moving on, I think
Do we have time for any questions today? A few minutes
we
for
do. We
questions?
do. I
Yeah.
think, let me get a couple in here. We talked about the things you can do to support yourself. We've often mentioned this, taking your vitamin D, making sure you've got vitamin C, especially the type that sticks around your cells, like a ester C based product, like ultra potency, some of the others. You've mentioned in the previous broadcasts, things along the lines of Ayurvedic medicine and others. Movement is good. You got to get out and walk a little bit, and hopefully your feet will feel better in the not too distant future.
Oh, for me, you're
Yeah,
talking
for
about
you too.
Yeah.
No, I was just thinking in general, I was reminded of walking is a good exercise.
Yeah, walking is very good for many reasons. For many reasons,
This is a question from Lori in Washington State, from Port
uh-huh.
Townsend. Lori, this is really funny because this will be me mostly with the type O. She said, "I'm craving red meat. Could my body be telling me something?"
Well, I'm a type O too, and I was really sort of vegetarian the last 2 or 3 months, and I had prime rib for Christmas Eve, and
Oh boy.
I loved it. I mean, my body just. But I prefer not having too much meat at all. I prefer just having it maybe once in a while, like almost like I was going to say a treat, but I don't want to use that term for beef.
Does Monica need a little meat treat?
Yeah. Woof, woof. So yeah, I mean, sometimes there's the B12, or as we studied in nutrition in university, it's called the meat factor. I don't know if that's been changed into another term, but there's something in cobalamin B12.
Yeah, the cyanocobalamin.
Yeah, that is found in meat, and sometimes that's what you need for to feel. That's what you need. Your body needs that. It craves that. It might be depleted. I mean, having perhaps B12 supplementation on a daily basis might be able to help that.
Well, and I don't know if you maybe have an iron issue too, because
hemoglobin might be
down. Why my thing is not working? That's what he said. There we go. I was going to say Lori. I've forgotten Lori's name. I'm so sorry. Yeah, it could be a question of anemia or something else like that. So we need a lot more information, but a craving usually is an indication that you're missing something.
Yeah.
So
see how you feel, see how you digest it, see how, maybe one serving is going to satisfy that craving and you're done.
I know that my wife does not do well with a lot of red meat, and
Is she an A?
I believe so. I don't know where we have that record. I think she probably is. I think she's the natural vegetarian, and so she can have it occasionally. But I think as long as we stick to being more of a pescatarian, she does a lot better with that. So.
Yeah, I know my husband also is an O and an A, and he came. We started dating. He was definitely vegetarian, and then he started eating more meat. And I think he would have just. I think he just does better with just vegetables. But now with his kidney dialysis treatments, I mean, he needs more meat now.
Well, I think that to me, and people like their meat different ways or so. I think it's funny because I'm the one who likes it as bloody as possible. Like if you just sear it on two sides and it's still mooing, I love that.
Not me.
I just love that.
My husband loved that too.
I'm just bloodthirsty, but my favorite combo is meat with a lot of vegetables. And not so much anything like bread or pasta or
an In-N-Out
even
burger.
Desserts. No, In-N-Out burger. I wouldn't take that normally. Or sometimes I've gotten the wrap, which is not too bad actually.
Have you? So you've never succumbed to the California In-N-Out burger mania?
Oh well, no, we go there a number of times. So usually I get the lettuce wrap. Yeah,
So
it's very rare. I think we probably go there. I want to say maybe 3 times a year.
I missed that.
Oh,
Could
sorry.
you say it again, please?
Sorry, Siri. Siri
Did you
is
say 3 times to In-N-Out burger. Is that what you said? 3 times?
In last year, I think, or 2 years. In the last 2 years, probably 3 or 4 times. Yeah.
Yeah, I think I go maybe once every 2 years.
Yeah.
And
it's a rarity, but then again, of course, I like things rare. But it's a rarity, and it's sort of like it's a treat for our 13-year-old. So
yeah.
But he eats very well here. So
I hope that answers Lori's question.
Yeah, Lori. I mean, it could be a craving. Usually, think about women who are pregnant; they crave often the types of new things that are in the nutrients that they need for having a healthy baby.
Yeah.
Okay, we have one more question we can do today.
Okay.
We got a little wrapped up in COVID. It's coming from Ed from Las Vegas. I don't know, Ed, if you're on the strip, probably part away from the strip. He says, I'm having difficulty getting back to healthy eating, and God, it's almost February. Help.
He said that?
More or less. I just put the God at something.
How?
I put God because I'm very faith oriented these days.
I don't know about you, but I think January, I was calling it sort of the leftovers from 2020. And I think there's been so much up in the air, and certainly, politically and otherwise, and
a lot of turmoil,
COVID and everything. So I bet a lot of people are somewhat stressed, and maybe you start, and here's another thing, you might have started on a good note, January 1, and now you've fallen off like after 5
days. And by January 6th, you were glued to the tube.
Exactly. That's the day of Epiphany. Did you know that?
Is it what?
The day of Epiphany is January.
Oh yeah, 6th. I do know that. It's also Christmas Eve in the Greek and Russian Orthodox tradition.
Greek Orthodox. Yes, it is. They were usually 2 weeks after us. I grew up with a lot of Ukrainian and Polish people in my neighborhood, and that's what they celebrated. We used to call it Ukrainian Christmas.
Yeah. So I mean, and so I think there's been a lot of stress eating between the 1st of January and now, which we're in the 22th.
22th, yes.
The 22th. So
so forgive yourself and start again. Every morning, start again.
It's always a new opportunity to start anew. I mean, the old hackneyed phrase was, today is the first day of the rest of your life, but it really is true. At any point, we can make a decision to alter the path that we're on.
It's interesting. I did this 6-week cleanse in November and part of December, and it was so interesting because the minute I decided, all of a sudden, my priorities shifted, and I didn't let everything be urgent. I let things slide that really weren't that important. And so if that's the case with you, Ed, if you're just sort of like inundated too much with a lot of drama, and if it's news, the best way to do that is shut off the news.
Do a news detox, which I must say in my Twitter feed is a lot calmer nowadays.
Oh,
it's so much calmer.
Oh, because there's no instigator, antagonist.
The instigators have disappeared in great numbers, and I'm having good conversations with people through Twitter, which is really hilarious to me because it was a place of such intense conflict. Yeah.
Yeah, so that must have been not so good for you and your health and your blood pressure.
Well, and also because we do a lot of social media work. So in terms of Twitter, Instagram, and other things like that for our digital agency, we are in there primarily for business, but I do enjoy real conversations back and forth on Twitter. And now the Instagram direct messages are just blowing up from the more recent app, which is Clubhouse, which is unfortunately only in
beta. I'm a part of Clubhouse, and yet I have not gone on yet.
Oh, we could do one of these in a room. We could actually do a simulcast.
Yeah, why don't we do that? Why don't we do that?
That would be very.
Everybody, you think that's a good idea?
It would be very innovative. So if you would like to hear us,
on
Clubhouse, when you can even do this away from here, we could actually have a private room there where we talk about these things. It doesn't have to be to the public. We'll come up with some good titles and see what can be done with that. And they can be short because I've been in some Clubhouse rooms where they actually are still going after 8 or 17 hours later, just because people pop in and they pop out. They come from the UK, they come from Hong Kong, from all over the world. And I don't want this to be a social media thing, but because it's an auditory app, you can really tell a lot about people, their intention through their inflection, the tone of voice, and everything else like that. And since I have a face for radio, I may try that out.
Yeah, and that's good. You won't feel self-conscious that people are looking at you, and you can just sort of.
And you can. People have been coming in from the beach, from their trips at a shopping center. People come in from driving, and I think there's a tremendous sense of freedom that goes beyond live video broadcasting. But the thing about it is
technically, you mean technically,
nothing is recorded unless you say in your title, this is being recorded, because it's actually against Clubhouse's terms of service. So
right, that's what I wanted to know.
Yeah, you can have some great conversations with people. And it's predominantly now celebrities and marketers and entrepreneurs and Silicon Valley types and investors. But once it opens up, it is going to be a good opportunity for the public in general to be able to interact with folks in a very specifically for health issues and things like that. So I would say, for those of you who aren't on it, you probably should get on it now. And it actually, in some ways, I have found makes the pandemic a little easier to adapt to, because there's a certain comfort in hearing people's voices who you know, like, and trust.
And it's anyone can come in, right? So how do you know?
Yeah, but you have to have an invitation, though.
How do you know if you know, like, and trust them?
Hopefully you know of them prior to going on the app. Maybe sorry, I'm going to have to mute myself. I'm about to cough. I think
so very interesting. There's I'll take over here for a minute, let you recover. But yeah, so there's all sorts of different things where you can feel connected. And I know that's one of the biggest missing pieces in since last March.
Staying connected. You don't have to be physically connected to have an emotional connection with someone.
Yeah, I mean, with my family in Canada, we do not do any Zoom, unfortunately. I don't know why we don't. It's just comfortable. We're so used to using the phone for years and years.
FaceTime?
We don't. Well, with my brother, we do. But I mean, I'm so used to calling them on the phone for years and years so it's sort of a natural transition to do that. But that's when you were able to see them. So it's definitely you're able to go visit them, but now that's not the case. So I think it's all
good. So we're going to reserve a number of questions for next week. I'm sorry I'm sorry we didn't get to all your questions, but Sean, Shannon, Evie, we'll get to you next week. So don't worry about that.
Yeah.
All right. We will be there, be here, be there or be square. Stay safe. Mask up, Buttercup.
Stay safe.
And we'll be back again at the same bad time, same bad channel.
What date is it next week? It's like the 29th.
30th.
30th.
Yes, because yesterday was the 21st.
That's right. That's right. 21-21.
21-21.
Yeah.
The 21st day of the 21st century. Yes, that's right.
Yeah, all of that. What he just said.
Whatever it was. Okay, bye. We'll see you next week.
Bye. Have a good week,
Pacific,
everyone.
4 p.m. Eastern. And for those of you in Hawaii, I believe it's 11. Yes, 11 a.m. Bye.
Bye.